If you're turning 65 soon or already on Medicare, you've probably heard the word Medicare a lot, but maybe you still feel unsure what it really is. Today, we'll explain Medicare clearly and simply, covering what Medicare is, who qualifies, what the different parts cover, how it works and your choices. Let's begin. What is Medicare? Medicare is a federal health insurance program in the United States, mainly for people aged 65 and older. It also covers certain younger people with disabilities and anyone with end-stage renal disease, a serious kidney condition that requires ongoing treatment. Medicare is separate from Social Security, but enrolling in Social Security often enrolls you automatically in Medicare Part A if you're already receiving benefits. Medicare helps pay for many of the healthcare services and medical supplies you may need as you age. How Medicare works. To begin using Medicare, most people first enroll in Part A, hospital insurance, and Part B, medical insurance. Once enrolled, you'll choose how you want your coverage delivered. You have two main overall options: Original Medicare, Medicare Advantage plans, a private company alternative. We'll explain both in a moment. Medicare Part A, hospital insurance. Part A is often called hospital insurance because it helps cover inpatient hospital care, skilled nursing facility care, hospice care, some home health care services. Most people don't pay a monthly premium for Part A if they or a spouse worked and paid Medicare taxes for at least 10 years. But Part A does have deductibles and co-insurance, so it won't pay 100% of costs in every situation. Medicare Part B, medical insurance. Part B helps pay for doctor visits, outpatient services, preventive services like screenings and shots, durable medical equipment like wheelchairs or walkers. Unlike Part A, Part B usually does have a monthly premium you pay. This premium can vary based on your income. Higher earners may pay an extra amount called an IRMA surcharge. Part B also has an annual deductible before Medicare starts paying its share. Medicare Part C, Medicare Advantage. Part C is also called Medicare Advantage. It's offered by private insurance companies approved by Medicare. Instead of Original Medicare, Parts A and B, Medicare Advantage plans bundle Part A, Part B, usually Part D, prescription drug coverage. Plans may also offer extra benefits like vision, dental, or hearing services. However, with Advantage plans you may have networks you must use, meaning you go to doctors in the plans group rather than anywhere that accepts Medicare. Costs, rules, and provider choices vary by plan, so it's important to review them carefully each year. Medicare Part D, prescription drug coverage. Original Medicare does not cover most prescriptions, so many people add Part D drug coverage to help pay for medications. Part D plans are also offered by private companies approved by Medicare. Premiums, deductibles, and formularies, the list of covered drugs, vary by plan, so it's worth comparing to find one that fits your needs. Other coverage options. Even with Parts A, B, and D, there can still be costs you're responsible for, like deductibles, co-insurance, and co-payments. To help cover these extra costs, some people choose Medigap, also called Medicare Supplement Insurance. These are private policies that help pay some of your out-of-pocket costs under Original Medicare. Medicare Advantage plans often include Part D and may help control out-of-pocket costs too, but each plan is different. When and how to enroll. Most people first become eligible for Medicare when they turn 65. There's a 6-month window around your 65th birthday when you can enroll without penalty. If you don't sign up for Part B when you should, you may have to pay a late enrollment penalty later unless you have qualifying coverage from work or other insurance. You can enroll through your local Social Security office or online at socialsecurity.gov. Once enrolled, you'll receive a Medicare card that shows what parts you have. That was a simple overview of Medicare, what it is, who it's for, and how the different parts work. If you're turning 65 soon or helping someone who is, understanding Medicare is one of the most important steps in planning for health care and retirement. For more detailed help, you can visit Medicare.gov or call 1-800-MEDICARE, both excellent official resources that explain your options clearly and for free.